I used to be an airline pilot, and so had a lot of independence, a lot of responsibility. I was used to taking care of my family, and when I had my first seizure, I was diagnosed with a brain tumor, which I ended up not having a brain tumor. And I remember having a discussion with our flight surgeon at Delta, and when he found out that it was not cancer and that I just had epilepsy, he said, "That's a shame, because it would have almost been better had you had a brain tumor." And I didn't really get it at the time, and he said, "The FAA understands brain tumors, but they don't understand epilepsy."
Understanding is key. Indeed, a person living with epilepsy should never feel as if they have nowhere to turn. Chronic health disorders such as epilepsy bring many questions, and thus, getting creditable answers to these questions is important in helping that person and the family manage epilepsy's challenges.
I mean, I've had epilepsy for 8 years, and I still don't understand all the different types of seizures. Until I've seen them a couple times, I'm still uncomfortable around them. So I can understand how that would affect people in the work environment. For instance, the FAA not wanting to clear me to go back to work. I would say it's a lot more work getting people comfortable around me and my environment.
The Epilepsy Foundation of Greater Cincinnati and Columbus provides professional counseling and assistance to people living with epilepsy, the tools to cope with issues related to their medical condition and to improve their quality of life. By phone or at the office, trained social workers and counselors are available to provide reliable, trustworthy information. Epilepsy prevention, seizure types, treatment models, and management issues are all addressed and may include direct assistance or referral to appropriate service providers in the community.
I could call up Doug Simmons and tell him a story, and it might sound horrific to somebody who doesn't have epilepsy or who isn't around it all day. But Doug would get it, and I could talk about it just for a couple minutes. And that might be the first time I've talked to him in 6 months. I can get off the phone, and I would say it's huge, makes a huge difference for somebody in my situation. It's frustrating having epilepsy, and I'm guilty of it myself. Before I had my first seizure, I didn't know very much about how seizures worked, how different each epileptic is with their seizures. It's scary sometimes to see people don't know how to react, don't know how to treat you, don't know the first thing about taking care of somebody who's having a seizure. So I think the Epilepsy Foundation is working towards education.
The Foundation sponsors support groups that share tips, mutual concerns, common issues, challenges, and successes with other members, all in an effort to help meet the struggles faced by those with epilepsy. Clients can develop the knowledge and skills necessary to handle common challenges, such as isolation, medication compliance, navigating public benefits, difficulties with the school system, and employee discrimination.
And I can't imagine other towns or, besides Cincinnati or Columbus that don't have this resource available to them. I think it's important, just to keep the awareness out there.
Whether you're a parent of a newly diagnosed epileptic child in search of guidance from those who've been there, or perhaps an adult with epilepsy looking for advice and encouragement from others, or simply looking for someone who understands your challenges, we have a support group that's right for you.